Assalamu alaikum wa rahmatullahi wa barakatuhu. Today our medical topic will be Tetralogy of Fallot, inshallah. Firstly, we will focus on the word tetralogy. Tetralogy in Latin word, it means four. So we have four characteristic features that will constitute this particular heart disease. Fallot, he is a French physician who named this disease. Tetralogy of Fallot itself, it's the commonest cyanotic congenital heart disease that in some references mentions that about 75% of all children who are above 2 years with bluish discoloration, they are having Tetralogy of Fallot. The four constituent features of Tetralogy of Fallot: firstly, we have narrowing or stenosis of the pulmonary valve. As we know that the pulmonary artery in the normal heart, it will exit the right ventricle, yes, and this is the valve of the pulmonary artery, and it will go to the lung in order to perform the gases exchange. The second feature is thickening of the wall of the right ventricle, okay, hypertrophy of the right ventricle. The third feature is ventricular septal defect, and we have displacement of aorta over ventricular septal defect, means overriding of the aorta. This is the aorta, it is over the area of the ventricular septal defect. By this picture we will illustrate the pathology of Tetralogy of Fallot. Narrowing, firstly, we have the most dangerous feature and the most important feature that will reflect the severity of Tetralogy of Fallot. It is narrowing of the pulmonary valve or stenosis of the pulmonary valve. Okay, as we know that in the normal heart we have a blood will comes in from the body into the heart by superior vena cava, inferior vena cava. This is deoxygenated blood. Okay, by tricuspid valve it will goes into the right ventricle. From the right ventricle it will be pushed or pumped into the pulmonary artery in order to go to the lungs, okay, in order to perform the gas exchange process. But in Tetralogy of Fallot, when the blood from the right ventricle is supposed to be pumped into the pulmonary artery, it is exposed to a near obstructed area. Okay, so the muscle here will push or pump the blood into the right ventricle, into the left ventricle, sorry. Why? Because we have a basic law in physiology that the fluid in our body will take always the easiest and the shortest path. Okay, so it will go into the left ventricle, okay, from the right ventricle to the left ventricle, because here we have no stenosis. In contrast, here we have a ventricular septal defect, means that we have here opening. Okay, so the blood will flow into the left ventricle, while here it will not go into the pulmonary artery because we have stenosis. Okay, when the blood pass to the left ventricle, so we have red blood with blue blood, red blood with blue blood, oxygenated. Deoxygenated means we have purplish blood, and this is why patient with Tetralogy of Fallot, he is cyanotic, because we have oxygenated blood with deoxygenated blood. The shunt is from the right side to the left side, and we know why it is from the right side to the left side. We said because we have a stenosis. This stenosis will make the muscle of the heart to be overused or to be in excessive exercise. So this will make the muscle to be hypertrophied day after day and lead to thickening of the muscle. The muscle, when it's thickened, it's hugely powerful to push the blood through the ventricular septal defect into the left ventricle. From the left ventricle, the purplish blood or the mixed blood will be pumped into the body, all the body structures and organs. So from the previous pictures, all we have seen that severity of pulmonary stenosis will contribute to the severity of cyanosis. Okay, as we have severe pulmonary stenosis, we will have more severe cyanosis. On physical examination, patient with Tetralogy of Fallot have peripheral cyanosis and central cyanosis. cyanosis of the extremities, and the lip and the tongue, mucous membrane of it. Finger clapping is the second feature, and on auscultation we will hear ejection systolic murmur. In the next lecture, inshallah, we will continue with you the features of the trilogy of value, the diagnosis, and the treatment. Inshallah. Thank you.